All right. Hi, everybody. Happy Thursday. Welcome to Chai with Chiruba. I have my green tea today. Um, and wherever you are, grab your chai. I'm trying to adjust the light here. Grab your chai and let's do some Q&A today. We had a lot of questions come in through YouTube and Instagram. And so we're going to answer some of those questions today. Let me just turn on the light. Can you turn on the light, Papa? Shh. Okay. There we go. It's a little bit better, I think. Okay, great. All right. So I would love for you guys to ask questions. Just type it in the chat. I think we have some questions prepared ahead of time from those that came in on YouTube. So I'm going to answer those, and hopefully this will be an impactful session. We are coming up on the end of Fibroid Awareness Month, but that doesn't mean that our awareness and our conversation stops here. We know that fibroids affect so many women throughout the world. So I'm happy to answer more questions to empower you and to get the information that you need. All right, so let's start answering some questions that have come in. Okay. I had my fibroids removed 6 months ago and I still feel sore and bloated. Is that normal recovery or something else? Okay, so this really depends on what type of surgery you had. Was it laparoscopic surgery? Was it open surgery? Like, as in, did they make a big incision? And then what type of incision was it? Was it horizontal? Was it vertical? So a lot of factors can go into determining why you're feeling bloated. 6 months though is a good enough time for your tissue and your body to heal. So if you're still feeling bloated, I would definitely see your surgeon. Maybe you need another pelvic ultrasound to make sure new fibroids haven't come up or ovarian cysts have not formed. So I would definitely consider seeing your surgeon and getting some more imaging to make sure that nothing new is happening and that you're healing appropriately. Typical healing time is about 6 to 8 weeks. Okay. I've been waking up in the middle of the night drenched in sweat, but I'm only 39. Could that really be perimenopause? It could be. Perimenopause starts sometimes in the mid 30s to late 30s. So you're right in that age group. There are other things that could cause night sweats. However, there can be other kind of other diseases, especially of the blood. It could be a side effect of certain medications that you're taking. So you want to make sure that you review all of that with your physician to make sure that something else is not causing night sweats. Even diseases and disorders like sleep apnea can cause night sweats. So it doesn't necessarily just mean it's perimenopause. You want to really look at it very holistically. And if it is perimenopause, then you may be a candidate for hormone therapy, even though you're 39. So getting some blood work, getting a full history, and seeing what else is going on is going to be super important. I think one of the things I see with perimenopause is sometimes there's other major things going on, but when all else fails, people just say, oh, it must be perimenopause and menopause, which to me is one of the biggest disservices because we are then ignoring other critical issues that are happening. So always look at it with a wide lens and see what else is going on. Okay. Caribbean Girl Shine, do you do consultations? Yes, I do consultations. So if you are in California, we will establish you as a patient and we can do a virtual visit. So if you're in San Diego or LA or anywhere else in California, if you are somewhere else in the country or in the world, you can definitely set up a fibroid coaching session with me by emailing us or calling us. And we spend an hour going through all your questions and, giving you input on your situation. Absolutely. My doctor said my labs are fine, but I feel exhausted, moody, and disconnected. Could this be hormonal even if my blood work looks normal? Prakash? My son is crying. Okay, so this happens sometimes where your labs are fine, your estrogen is not low. I'm assuming this has to do with a menopause question. Um, but as we get older, our estrogen goes down, our testosterone goes down, and we start to feel, unwell. And so, yes, I have seen situations where the lab work is actually normal, but patients are just not feeling themselves. And so, depending on your age and your other medical conditions and what else is going on, we can certainly do a trial of hormone therapy, and see if that makes you feel better. So, yes, to answer your question, yes, you could, feel all these things with normal labs, and you just want a very thorough discussion with your physician. Okay, I've been told I need a hysterectomy, but I'm afraid of how it will affect my identity and my hormones. Can I talk about these fears openly? Um, Sorry, guys, I need to hold on one second. Um, Prakash, I'm doing a call. Sorry about that, guys. Real mothering while trying to do chai with churba. So, okay, sorry. Okay. I've been told I need a hysterectomy, but I'm afraid of how it will affect my identity and hormones. Can I talk about these fears openly? Absolutely. So, I actually did a YouTube video, I want to say 3 or 4 weeks ago, about fibroids and getting fibroid surgery, whether it be a hysterectomy with your ovaries or hysterectomy without your ovaries, and how that actually affects your hormones, and your estrogen levels. So please listen to that. So one of the biggest things here, I want to let everybody know that a hysterectomy does not mean that you need your ovaries out. Okay, so that's a completely different procedure. When we do a hysterectomy for fibroids or endometriosis or whatever, we are not necessarily taking out the ovaries. Now, if we do take out the ovaries because you've got a big cyst or you've got dense scar tissue, then yes, we are compromising estrogen levels. So this is a conversation you must have with your surgeon ahead of time. Whether, is it that you're taking my ovaries out? Are you taking out one ovary? Are you having to take out both ovaries? Is there a possibility of taking the ovaries out? In which case, you really want to make sure that you are getting hormone replacement therapy at that point. So this is a conversation not to have like after, but you want to definitely be prepared. But if you're getting a plain hysterectomy without your ovaries being removed, then you don't have to fear. You're not going to suddenly lose your identity. Your hormones are not going to change or anything like that. So I don't think you need to get concerned about that. Having said that, with a hysterectomy, you do reach menopause about a year earlier than average. So if you were going to reach menopause at 52, you may be reaching menopause at 50, 51, 50. And this is because there is some shared blood supply between the uterus and the ovaries. And so even though you're not touching the ovaries, just taking the uterus alone does compromise some of this blood supply. So that's what you really need to know about, reaching hysterectomy and how it affects menopause. Okay, yes, we have the video up here. Will fibroid surgery put me into menopause? Definitely take a listen to that. We go through the details there. I had fibroids removed 3 years ago, and now I feel the same symptoms returning. Do they really grow back that fast? Yes, unfortunately, they do. We have seen them even as quick as a month. A year. So with 3 years, I can definitely see how that would be happening. So after fibroid surgery, one of the things I tell patients is, hey, you should really get screening, probably every year, especially if you're somebody who's considering fertility, because fibroids, once you make fibroids, you tend to make them again. And so we want to make sure that these are not growing and that they're not going to be a problem for fertility down the road. Okay. Um, I'm having hot flashes during client meetings and it's starting to affect my confidence. How do other women manage this at work? This is an excellent question and something we get very frequently where women are talking in a meeting and suddenly they're having hot flashes or just starting to have to, take their jacket off. And many find it very embarrassing. And, first, I think it's it's okay to normalize it, right? So it's okay to say, "Give me a moment, I'm having a hot flash." Like, I mean, it is the truth. And I think people empathize with that. And even though you may be so embarrassed, it's not a bad thing to say, just to normalize it. Hey, this is what's happening. I've seen more and more people do that, and it actually builds empathy and spreads knowledge. And like, hey, this is just a normal part of what's going on. Just like when people are sick, they're sneezing or coughing, and they're embarrassed and they feel bad about it, but that's what happens when you're sick. So similarly, I think this is a normal part of human physiology, and I think acknowledging it is a good thing. But then also getting treatment for it with some menopause hormone therapy is an excellent idea. So I would definitely speak with your physician about, your symptoms and see if you're a good candidate for hormone therapy, which most women are. And, you know, putting on a patch may be all you need to really quell those symptoms and, have the confidence and not feel like you never know when you're going to feel really warm. Okay, what are your thoughts on using castor oil for ovarian cysts? This is probably one of the most commented on videos on my YouTube channel from a couple of years ago. So there's a lot of, I think, claims that castor oil shrinks fibroids and castor oil takes all your fibroids away. Now, if that was the case, we would not need to be doing fibroid surgery. We would not be needing to take all these medications or even talk about fibroids as much as we do, because everybody could just put on a castor oil pack and call it a day, right? But we know that that is not true. Now, are there some benefits of castor oil? Sure. Just like there are so many other anti-inflammatory, more holistic um, properties of so many oils and essential oils and vitamins and supplements and all of that. Like it can help soothe it, it can help calm it down, it can help your symptoms, especially if you have degenerating fibroids, if you have painful fibroids. Absolutely. Those things can help. But I would not say that putting, castor oil is going to help your fibroids or your ovarian cysts for that matter. So I think you can symptomatically use it for symptom relief. And, for those who strongly believe that it reduces the size, I mean, maybe, but I would hesitate to really use that as your primary treatment. If you've got a big ovarian cyst that's 15 centimeters, you probably want to take a look at it, get some imaging, see a doctor, make sure it's nothing weird or dangerous or malignant looking, versus just putting castor oil. But if you're having, intense ovarian pain from your periods every single month, just like we put a heat pack to help with symptoms, I think castor oil is perfectly acceptable to do for that. Okay. I've had abnormal pap results for the past 2 years, but my doctor keeps saying there's nothing to worry. Um, so if you've had abnormal results for 2 years, there's usually something we should be doing. If it's just 1 year, that's okay, depending on, of course, what your result is. But there are some results that are not very serious, and we can watch it for a year before we actually do an intervention. But usually after 2 years, if it's abnormal, there's something to be done, either a colposcopy, which is a small procedure, or a repeat pap right away. Or another invasive procedure. So yeah, you may want to just get a second opinion, just to make sure that that's legit, and make sure that you're doing what you need to get done. I just found out that I have HPV and I'm panicking. Does this mean I'll get cancer or that I was irresponsible? Okay. So, this is a very common topic that so many women talk about and are super anxious about, right? So, HPV is human papilloma virus. This is the virus that causes cervical cancer. So that's just the fact. Now, cervical cancer does not grow overnight. It's not like breast cancer or ovarian cancer or colon cancer or brain cancer or all these other cancers where you were doing fine one day and then bam, somebody tells you you have cancer. Cervical cancer is not like that. Cervical cancer takes years and years to grow. There are multiple stages of it before it gets to cancer. We often pick it up very early and do, procedures to get rid of the abnormal cells. So it does not mean you'll get cancer. If you are seeing a gynecologist every year and getting your appropriate screening, you should be okay on that front. Now, I don't want to make any judgments on whether you were irresponsible or not. I don't know the context of what was happening, but essentially HPV is an STD. It's a sexually transmitted virus, right? So you get it through genital contact, through intercourse, and this is how it's spread. So if you have unprotected intercourse, there is a high chance that you may get HPV because it is the most prevalent STD in the United States. 60 to 70% of women have HPV. That's a lot. That's almost the whole population, right? 70% of women. So it's super common. And women are tested, men are not tested in this country. So men often are the ones who are spreading it, but they don't know that they have it in the first place. So there's really no way of knowing if somebody truly has HPV, especially when it comes to men, unless they have like a wart or something that's obviously visible, or they got tested, in Europe or somewhere else. There's really no way of knowing. So I just tell patients, you always got to be careful, use protection, use condoms. And even then, genital contact can still spread HPV. So it's not 100%. So, yeah, so you just have to be extra, extra careful. And even with women and women, there is transmission there too of HPV, although less than men and women. But it is still something to be thinking about. Ever since I had my second baby, I leak a little when I laugh or jump. Is this part of motherhood or should I see somebody? Yeah, this is a really common thing that happens after childbirth, where you laugh, cough, sneeze, you leak a little bit because your pelvic floor has just been weakened. I don't think you should accept this as normal. It can happen, but it does not mean that you need to live with it. So I would definitely see a pelvic floor therapist. There are many around, depending on where you live. I know in Northern California, we have so many great pelvic floor therapists. I would see them, get some, have them examine you, see what the problem is. Is your pelvic floor too loose? Is it too tight? All of these can lead to these issues. So definitely see them now to get this taken care of. I also really love this app called Every Mother. It's a great app that focuses on the core, and strengthening the core, which then goes down into your pelvic floor. So really strengthening the core is important. So those are the two resources that I would suggest. Any other questions? I keep seeing ads for vaginal rejuvenation lasers. Are they actually helpful or just expensive hype? They can actually be very helpful, especially as you lose estrogen, the skin gets drier, less elastic. There are several on the market, and I've had a lot of patients have great success with them. So yeah, I think you want to just see the data of what, which laser you're considering, and also make sure that, after those 3 sessions that you're actually seeing improvements. But I do think most people see improvements, and it's been a godsend to many, many, many patients. But you also want to make sure you're on vaginal estrogen. If you're having symptoms of the vulva, the vagina, any dryness, tightness, you want to make sure that you're on vaginal estrogen as well. I had an IUD removed a year ago and my hormones haven't felt right since. Is that normal? So it depends on which IUD you're talking about, but I'm going to assume that you're talking about the progesterone IUD. So with this IUD, of course, it's giving you progesterone on a day-to-day basis, kind of all the time in a very steady state. And so suddenly, when you remove it, yes, you could be having symptoms, just kind of progesterone withdrawal, or maybe it was giving you a little progesterone that you were lacking. And now, since it's gone, you just feel a little bit different. It depends on how old you are and what else is going on, but you may want to see your physician to get a full workup and, maybe check some hormones and see what else is going on with you as like a whole person, and see if there are other hormonal imbalances that are happening. I've tried 3 different birth control pills and all of them have made me feel off. What are my other options? So it depends what you're asking this for. If you're thinking about contraception, there are many different birth control pills. There's progesterone only, estrogen and progesterone. There's a little rod that you can put in your arm right here, called Nexplanon, that gives you 3 years of protection. There are IUDs, there are patches, there are rings. So there's so many options. Excuse me. So I would talk to your doctor about, some alternative methods. Maybe you don't want something oral. Maybe you want something transdermal, like through your skin, or vaginal, that may just absorb a little bit differently and kind of sit with you a little bit better than taking oral pills. We'll take a couple more questions if there are any. Okay. I've been getting frequent UTIs and vaginal irritation, but nothing shows up on tests. Could it be something hormonal? Absolutely. It could be that you are having low estrogen. I don't know how old you are, but if you are in perimenopause or menopause, you should definitely be on vaginal estrogen, which is safe. It comes in many different forms, but the easiest is a little pill that you put in the vagina twice weekly, and it really helps with the pH of your vagina and helps restore the pH and can prevent these UTI type symptoms and the vaginal irritation. So you definitely want to check that out. Okay, I'll take one more question. Okay. I freeze every time I go to the GYN. I never know what questions to ask. What should I be asking during a visit? Excellent question. Now, it really depends on how old you are. And hopefully, a good gynecologist is also going to guide you with questions that they're going to ask that then will trigger you to be like, oh, yeah, I had a question about that. But really, a GYN exam is, depending on which kind of doctor you're seeing and what kind of model you're in, insurance based or cash based, will determine how much time you have. So for some people, their time is 7 minutes, and for other people, their appointment is an hour. So this will also determine what kinds of questions you have time to ask. But essentially, you want to make sure you're getting a breast exam. You want to make sure you're getting a pelvic exam, a PAP if it's needed. You want to ask about fertility. So maybe that's birth control, or maybe you're trying to get pregnant, and what that looks like, and if there's any problems with that. You want to make sure you're up to date with your cancer screening. So mammogram, PAP. I often talk to my patients about colonoscopy as well, and give them a referral to a GI doctor for a colonoscopy if they have not done that. So screening, and then also anything else that's going on, any abnormal bleeding, any pelvic pain, hormones. Perimenopause and menopause is a big thing. Now, if you really have a whole topic to talk about, like, okay, I really need to dive into menopause, oftentimes that is not done in a regular GYN visit. They'll often say like, hey, we don't have time today. You need to make another appointment. So just so you know that ahead of time. And again, this depends on what kind of model you're in. But these are some of the questions to ask. And again, this some of it will be based on how old you are, but these are the topics that we generally cover. Okay. Um, all right. This is the last question that I'm going to take. My doctor says I can't take estrogen because of my family history, but I feel awful without it. Are there any other solutions? Um, So it depends what you mean by family history. Is it a genetic thing? Is it a history of breast cancer? Is there a gene mutation? Is there a clotting disorder? Is there a early history of clots and stroke? So I am not sure exactly what you mean by family history, but that may determine whether you can be on estrogen. Um, but I would probably seek a second opinion as well. There's a lot of misinformation, even amongst doctors about this. So I would seek a second opinion from another gynecologist and see that truly whatever this family history is not allowing you to be on estrogen, because often that is not the case. So seek a second opinion and go from there. Yeah, because if you're a candidate for estrogen, you want to be on estrogen. So you want to take it from there. All right, guys. Thank you so much for hopping on. I hope this was helpful. Follow me on the Fibroid Doc on YouTube. Let me know if there are topics that you want me to cover. I really enjoy doing this every Thursday. And if you are in the Bay Area, in California, you're looking for a doctor, come and see us or do a virtual consult. It's myself and Dr. Christensen. And then if you are somewhere else in the world or the country, you can always do a coaching call if you just want more information about any of these topics that I talk about. All right, have a beautiful Thursday, and I will see you all next week. Bye-bye.